Welcome family, welcome to another beautiful edition of Annie Author's channel. If today's your first day watching me, please hit the red button that says subscribe and you will be among the very first people that will be notified whenever I post something new. If you're a returning friend, well-wisher, fan, please thank you so much for coming back, and do not forget to share, love and comment on my videos. So today's edition, I'm going to be talking about health issue, something very common. So if you have not experienced it, probably somebody you know, very close friend or family member, has this issue. So this is no other problem but what we know as mouth odor or bad breath, or halitosis by the medical name. It's called halitosis. So what is mouth odor? So if you haven't experienced it or you are denying, when you wake up in the morning, take a deep breath and do something like this. You will smell your mouth. So that one is very common and it's temporary. If it's something that happens in the morning, or something that happens when you haven't talked in a while, or something that happens when your mouth is dry, those ones are temporary and it can be easily gotten rid of. But the one that hits people so badly is the one that is caused by a medical condition, or the one that is a chronic condition. Those are the ones that are a little bit harder to get rid of, but it can be managed by taking good care of yourself. So let's go down the lane a little bit. What causes mouth odor? This mouth odor we are talking about, what causes it? So worldwide, about 25% of the people living in this world has mouth odor. Yes, so that's why sometimes when you're talking to somebody, you will see them shifting back, or they will put their face away from you, or they'll be doing some kind of funny things to prevent your bad breath hitting their face or going into their nostrils or mouth. Okay, so that's when you know you have bad breath. So in this case, what causes bad breath? So these are the common causes of bad breath. Number one, food and beverages. Okay, so the type of food you eat and the type of drink you drink can also cause you mouth odor. What I mean, examples are like garlic. Okay, garlic can cause your mouth odor, and again, if you drink alcohol, that can also cause your mouth odor. And other food particles left in the mouth, if you don't clean your mouth right after eating or flossing, this will increase the likelihood of bacteria developing in your mouth and teeth to increase, and this will eventually cause mouth odor. Number two, smoking cigarette and chewing tobacco. These are terrible. They can cause dental diseases, and these dental diseases will also increase the mouth odor because this is bacteria. This will cause bacteria to live in your dental and oral cavity, and this will cause mouth odor. Number three, poor oral hygiene. If you don't floss, if you don't brush, this is going to generate mouth odor because each time you eat, there are food particles left in your mouth and your teeth, you know. So if you don't floss and brush, this is going to ferment, and when they ferment, it's going to cause odor. They're going to smell. So think about it. When the food in your guts are turning into poop, the ones in your mouth are turning into poop as well. Just use that scenario. I'm not saying that's what happened, but you put that scenario in your mouth and that is going to stink. So make sure you brush and floss your teeth very regularly. If you don't have any floss, you can use toothpick and pick in between your teeth right after eating. And when you brush your teeth, please make sure you stick out your tongue and you brush your tongue. And also when you brush your teeth, I know commonly or naturally it comes that we do it this way, but no, the right way to do it is up and down, up and down, up and down. That's how you brush your teeth, up and down, and you spit. Okay, and also use a very good toothpaste that has at least some type of mint to it. It helps to freshen your mouth, and rinse thoroughly right after brushing. All right, another thing that can cause mouth odor is dehydration. You know, when your oral cavity is dry, your entire mouth is dry, it causes the saliva to be very, very sticky and gloomy and stinky. And that will cause mouth odor. So always make sure that you drink enough water to hydrate your entire system and also increase the production of saliva. So each time you swallow, your mouth is rinsed, and again the odor is being eliminated. So number 4, medication. Certain medications we take can turn out to cause us mouth odor. Some high blood pressure medications, diabetic medications, and even some antibiotics can also turn out to cause us mouth odor. So that's why it's very, very important to always brush your mouth, brush your teeth, clean up right after taking a lot of things. If you're not at home where you can easily reach your toothbrush and your toothpaste, always rinse off with clean water, and that will help to at least cleanse the oral cavity. All right, another one is periodontal diseases. Something like gingivitis, gum disease, cavity. All these things, when they happen, they can easily cause mouth odor. So that's why it's good to clean. So when these things causes plaque, and the plaque causes tartar, and the tartar causes gum decay and teeth decay, so that will automatically generate odor. Another thing that can cause mouth odor, sinuses. You know, when you have this congestion, nasal congestion, okay, so your deposed drainage from the nasal congestion will also cause you mouth odor. So if you breathe in deeply, or if you try to sniff inside, inhale deeply, you can smell, you can even taste the smell in your mouth. So if you have ever experienced sinuses, you know exactly what I'm talking about. The taste is not good. It is nasty, and the way it tastes in your mouth is the way it stinks out. Okay, so that's why it's very good to treat all the infections and diseases right away. Okay, and always brush your teeth more often. If you can always maybe use something like mint, and also cough drop, something that can easily generate salivation in your mouth, or even cause your mouth to change the odor. Maybe minted gum, you can also chew that to help clean your mouth and also eliminate that odor. Then another thing I want to talk about is some other diseases, chronic diseases like kidney failure, kidney disease, diabetes, sleep apnea, gastritis, and GERD. All of those things can cause mouth odor, and some of these things, the type of mouth odor they cause comes from your gut, okay, from your stomach, large and small intestine. These are the diseases, the odor that comes from that part of the body. That's why when you burp, you can smell it. Okay, whenever you burp, you can smell it. So those type of mouth odor comes from the gut, okay, and they are being caused by medical conditions. So make sure you address your medical conditions promptly, and your doctor takes care of it, and take your medications the way they're being ordered. Okay. All right, so what are the common things we can do to prevent or to treat mouth odor? What are the common things you and I can do? Okay, so when you experience mouth odor, or when you feel like your mouth is smelling, you know, it's very, very hard to tell somebody your mouth is smelling, or go and see your dentist, or maybe clean your mouth, or maybe shift backwards so that I won't be breathing so deeply of whatever you're producing, or maybe cover your nose and mouth when somebody's talking to you. It can be very, very embarrassing, and also, I don't know, it's an awkward situation. But if you know you have this problem, keep your distance when you're talking to people, okay? And also, if you have this problem, go and see your doctor. So how do we take care of this mouth odor or bad breath? Promptly clean your teeth, adequately brushing your teeth at least twice a day. Use a good toothbrush and toothpaste to clean your teeth, okay? If you're using a chewing stick like we normally do back home, please clean very, very well, okay? And also, another thing, under this cleaning, make sure you clean your teeth or your entire oral cavity. You lift your tongue up, you clean it. above, on top of your tongue, you clean it. On the roof of your mouth, you clean it. And inside your gum, you know, around those wisdom teeth, please make sure you clean very, very well. Spit and rinse with clean water. Okay, I've seen people gargle their mouth with salt. And another thing you can do to improve this thing is to use, if you have vinegar, use about 2 tablespoons of vinegar into 8 ounces of water. Stir very well and use your toothbrush to dip into it and use it to brush. Then after that, you can use the same vinegar water to gargle like 30 seconds. Gargle 30 seconds, and you spit. You can see your mouth freshening up. Okay, so again, adequate oral hygiene is very, very important. Number 2, stay properly hydrated. You got to drink. So if you're not drinking, your oral cavity gets dry and the saliva gets sticky and stinky. Okay, so that's why it's very, very important to always hydrate your system. Number 3, treat any underlying medical condition promptly. So if you're diabetic, please see your endocrinologist so that they can help you, or your primary care doctor so that they can help you address that issue. And if you have UTI, that's urinary tract infection, treat it promptly. If you have kidney disease, please address all these things promptly. If you have gastritis, colitis, GERD, and maybe cavity, any oral issue or gut issue, please make sure that you treat it properly and promptly. Okay, and another thing, if you take certain medications, make sure you brush your teeth right after taking it. I know some inhaler, you have to brush your teeth right after taking them. And if you smoke or chew tobacco, please stop. It's not good for your teeth. It's gonna cause dental disease, dental infection. Stop. But in the process of stopping, make sure you maintain good oral hygiene. Okay? Then if you drink alcohol, at the same time, stop drinking or reduce your drinking, and always practice good oral hygiene. All right, what else can you do? Increase your yogurt intake. I know my Niger people, they call it yogurt. All right, so increase your yogurt intake. Why? Because yogurt has probiotic. So the probiotic helps to maintain the bacteria, the good bacteria, that's normal flora in your guts. Okay, so especially those that their mouth odor comes from the gut. So when you eat a lot of yogurt, it's going to help to balance the normal flora in your gut system, and this will also help to maintain the good bacteria. So the good bacteria will eliminate the bad ones. And above all, yogurt has what we call lactobacilli, so that will also help you to increase your gut health. That's your stomach, your intestine health, to make it more healthy. And this will also eliminate those odor that comes from your gut, especially when you burp. Somebody that is in front of you will move backwards, or they will cover your nose. Please, to avoid all this embarrassment, take care of yourself. Okay, maintain good oral hygiene and gut hygiene. See your doctor if you have any chronic issue or underlying issue, and that will help you to maintain good oral hygiene. Thank you guys for listening. You can always put your input, ask questions or clarifications, or your comments will be very, very appreciated. Thank you guys. I love you. Bye guys.